The next set of disorders that I'm going to cover will be somatic, symptom, and related disorders. They've changed the names of some of these, so I kind of have to get used to using the newer names. And with this set of disorders, I will sometimes find that some students will be resistant to learning about these disorders, or they'll be dismissive of them. They'll say things like, that's stupid, that doesn't make any sense to me. Well, if you don't have a particular disorder, it may indeed not make much sense to you. All right, so please try to keep an open mind. And one of the things that is kind of that leads to this attitude is the fact that these disorders involve physical symptoms that have a psychological root of some sort. And some people don't like that idea. Like, they equate it to faking, or just trying to get attention, or having something all in your head, which doesn't get a lot of respect. But the mind-body relationship is quite complicated. Our psychological symptoms can be translated into some unusual physical manifestations. All right, now, and I do want to mention, if someone is faking an illness on purpose, that's not what we're talking about. That actually is called malingering. We are not talking about malingering. All right, all of the symptoms, all the physical symptoms we're going to talk about are very real to the person. The person experiences them as real. All right, so first of all, we are going to talk, all right, so somatic symptom disorder. What does somatic symptom disorder mean? This is a psychological disorder involving the combination of the presence of physical symptom plus abnormal thoughts, feelings, or behaviors in response to the symptom. All right, that's a general thing. You got some physical symptoms. You've also got some psychological stuff going on. And so we also are going to learn about something that has two names, essentially. We used to call this particular disorder conversion disorder, and now we are officially using the name functional neurological symptom disorder, which is probably more of an accurate term, but people are still using conversion disorder. In fact, I noticed that the test bank for this book uses the word conversion disorder still. And folks, I don't know if you know this, but I and many of your other professors, if we can just use the test bank that comes with the test book, we're gonna, because it makes our life easier than having to write questions from scratch. So most of my questions on quizzes and tests come from the test bank that comes with the textbook, so be prepared. So I'm warning you about, you can probably guess, there's a quiz question. There's a quiz question, at least at the time of recording, the quiz I'm using for this semester. There is one where it uses the word conversion disorder instead of functional neurological symptom disorder. So whether you call it conversion disorder or functional neurological symptom disorder, what the heck is it? You have a sudden loss of functioning of some sort, and it makes no physical sense, basically. Like someone, all of a sudden, they're like, I can't see. And you examine their eyes, you examine their optic nerve, and you're like, you should be able to see. But to the person, they have the very real experience of blindness. They're like, I cannot see. And we used to have fancy terms. If you ever hear hysterical blindness, that's what they're talking about, which fits in this category. And so you have the sudden temporary loss of a sensory or motor function. So the blindness would be like a sensory loss. Motor loss would be like, my arm doesn't work. I can't move my arm, something like that. So it can include blindness, paralysis, deafness, or numbness of particular body parts. All right, so the idea here is the person cannot sense, or they cannot use that part of the body. It's very real to them. They're not making it up. They're not faking. They're not just trying to get attention. They are genuinely distressed because this is not working for them anymore, but there's no physical explanation for the symptom. All right. And yes, that is unusual, especially when you have traditional views about, you know, how illness should manifest in physical explanations and whatnot. But this does happen in some individuals. Now, another somatic symptom disorder that we're going to talk about is illness anxiety disorder. We used to call this hypochondriasis, or call someone a hypochondriac, If they had this, you might have heard that term before. It's okay if you haven't. Illness, anxiety disorder, you're constantly worried that you're getting sick, essentially. So it's significant health anxiety and anxiety-related checking and avoidance behaviors. This is someone who wants to go to the doctor quite often to check, to get tests done. They might do things like they're doing frequent skin checks because they're worried about getting skin cancer. They might be frequently like checking their stool in the toilet and stuff because they're worried that they might see blood, or they might see evidence that they're getting sick. You know, they're going to go to the doctor. They're going to have lots of questions because they're just waiting for it to happen. And some people, that's how their anxiety can come out with this illness anxiety disorder. All right. So again, these folks aren't faking. The symptoms, the fear, the worry, it's all very real to them. They are genuinely concerned about being sick. Now, sometimes folks in this category, they may be treated for physical illness first. It usually takes some time to rule out physical explanations, and so sometimes a psychologist or a psychiatrist doesn't come in until later. They say, well, I can't find any physical cause for these symptoms. Can you figure anything out? And then sometimes a mental health professional will come in and say, oh, I think we might have a somatic sensory disorder going on here. All right, so that's what I want my students to know about these disorders. The next video is going to be about a controversial set of disorders called dissociative disorders.